Hi, I'm Kerry Fink with Helping Seniors of Brevard, and it's time for Friday's Helping Seniors Update. And here we are. My special guest today is Dr. Kevin Kilday of the Holistic Health Center. Hey, Dr. Kevin, how are you?
I'm doing great. Thanks for having me.
You know, it's really amazing if you think about it. Today is Friday. It's May the 29th. So this is actually the last weekday of May. It's really kind of amazing when you think about it with all that we've been through. It seems like it's been a long time, but it also seems like it's been no time as we've been working through this COVID-19 thing. Now, as we're talking today, Dr. Kevin Kilday, that we are at the first phase one reopening of Brevard County. Things are starting to kind of get back in action. And so that's what actually one of the things we wanted to talk a little bit about today is you had written an article that was about mental health concerns during the pandemic. And I know that we see a lot of things on the news today where they're trying to balance the safety of keeping us staying at home and social distancing and all those things. And at the flip side of it, then a lot of people are having mental health concerns and other things that we keep hearing about in the news as well. And so I guess it's really a lot for the government officials to kind of balance that out and try to get to the right path. But I wanted to ask you, Dr. Kevin, a little bit about some of the thoughts that you wrote about in that article. You said you talked about overwhelming stress. Can you talk a little bit about that aspect and what that means right now?
Right. There's the general public is, is suffering from, some depression and anxiety and overwhelming stress, from this pandemic.
Mm-hmm.
And in the article, I focused, or I mentioned about the, like even the frontline workers.
Mm-hmm.
I made a point about mentioning them, and not just the doctors and the nurses, but I also mentioned the firefighters and the EMTs, and the police officers and the nurses, and because they're under overwhelming stress also. And even though they've been trained, but they are human. A lot of them are separated from their family and friends for long lengths of time, depending on how busy their hospital is. And so I just made a point that they too, suffer from the negative effects of this pandemic. And some of the things that I mentioned that the public can do, as well as the frontline workers, is to make sure that you get enough rest, because people tend who care for people have a tendency to overdo it.
I was going to say, what we're discovering, because we operate the Senior Information Helpline here in Brevard County. And so Kim Bernard, our education specialist, gets all these calls at 321 473 7770, 321 473 7770. And we were talking about the kind of calls. And as you talk about this, one of the challenges that we all have with the social distancing and staying at home is social isolation. And so, there is a lot of stress out there. People, not only about themselves, even if they feel personally safe, we're getting a lot of calls from seniors, for example, who are concerned about trying to be able to get out and get supplies, not necessarily for themselves, but even their pets and things like that. So you wrote in this article, you gave 3 strategies that you said frontline workers, as well as all of us, can use. And one of them that you mentioned already was getting adequate rest and sleep, taking a break. And like you mentioned, particularly for caregivers, this is extremely important. But you said another thing is free up your feelings. Experiencing overwhelming stress, no matter how much training you've had, you're human. It is by no means a sign of weakness or a bad reflection on you. Wanted to get you just to add something on that.
Right, because I'm also a professional also, and I experience, things just like everybody else does. And the same with doctors and nurses and firefighters, EMTs and all them, experience those things also.
Mhm.
So I was just reminding people and the frontline workers to express your feelings. I mean, even though you're working in a professional environment all day long, just talk to a trusted colleague or a
Yes.
friend at work, or call your family. And like I also said there, just take a break and find some coverage or something for your shift and go out and do just a day for yourself. I
It
mean, I
is
know
so.
this is it's just a major problem, and everybody is called to duty. But like I said, you're only human, and everybody needs to just step back sometimes and just take a break and and just recharge their battery. Let's say.
As you and I were talking before we started the Helping Seniors update, you said the third thing is to monitor your mental health. If you're sleep deprived, depressed, anxious, overwhelmed, feeling hopeless, you got to get professional help. And that tags in with something that you said over and over: seek help.
Exactly. Unfortunately, the mental health statistics are rising, at a rapid rate. They say, even seeking, just online, or going online on hotlines and things like that, have increased, over 65%.
Wow.
And when people are under, a lot of stress, depending on the person,
Mhm.
sometimes, they lean towards, relaxing things if it is for them, of drinking and, some other activities, so, um, it just can be a problem. I mean, like every statistic so far is saying that, that drug abuse and suicide in particular are very, very high. They really are, and it's a very it's just it's an effect, after effect. Well, not even, you can't even call it an after effect because we're still in the middle of the pandemic. So it's just a disturbing effect of this pandemic.
If you do feel like you need help, it's always a good idea to reach out. Maybe you have a trusted religious counselor or somebody that you trust on that level. But also, this is what you do at the Holistic Health Center. In fact, we were talking also that you're ramping up for telehealth, meaning that people are going to be able to visit with you safely and securely via Zoom call, very much like what we're trying to do right now, where you are able to talk with them. And your background as a counselor that have worked with hundreds, if not thousands, of people with addiction and things like that, people can get in touch with you and start to schedule appointments. What number do they reach you at?
They can reach me at 321 549 0711.
And let me have you say that one more time.
Yeah, 321 549 0711. If you don't get me personally on the phone, then just means I'm just tied up on the phone. I will get back to you, by the end of the day.
And you also have quite a robust website, right? At holistichealthcenter.us, holistichealthcenter.us. And there's a lot of tools and things there that people can be reading as well.
Yes, I do have a recent program I put together called Holistic Addictions Therapy. And, if I can make just one other small point, I know we have a time frame here. A lot of people got to realize that that people who were in recovery and were attending meetings on a daily basis to help their recovery. When the churches closed because they were not considered an essential business, and most of these all these meetings, matter of fact, or majority of them, are in churches. So the meetings of Alcoholics Anonymous and Narcotics Anonymous were stopped. And a lot of, in most cases, recovering addicts, replace those meetings as like their drug. They like the camaraderie of other recovered addicts that helps them, and they help each other. So that is also a big problem. I'm glad the churches now are starting to open up, and maybe some of the meetings are opening up. But like I stated in that article, if you are in recovery, the phone is the best thing, is to call other people that that you were in the meetings with, get in touch with them, ask them how they're doing, say, hey, you want to get together for a coffee, or I know this meeting that's just opening up again, let's go to it, and things like that. So, because, unfortunately, the alcohol industry, they were saying that alcohol sales were up 55% during the quarantine.
So again, to give you a call and maybe have a conversation with you, tell us your number one more time, Dr. Kevin.
Yeah, 321-549-0711. I'm a licensed practitioner. I specialize in pastoral counseling, or spiritual counseling, biblical counseling. And also I have a degree in doctorate in natural health. So I'm able to help you holistically, mind, body, and spirit.
Yeah, and as we close out for today, I want to remind viewers to get a hold of the June edition of Senior Scene magazine, because in the Helping Seniors newsletter, which is always tucked in the center section of each edition of Senior Scene magazine, you'll find the Helping Seniors newsletter. It's always got great articles from our president and founder, Joe Steckler, always great advice for seniors. And you've got an article in the June edition upcoming that's titled Rebuild Your Immune System, Prevent Disease. So make sure that you're looking for Dr. Kevin Kilday's article in the Helping Seniors newsletter, which you can either find on our website or by picking up your copy of Senior Scene magazine. Also, on kind of that same bench, I want to suggest that you take a look at holistichealthcenter.us. That's Dr. Kevin Kilday's website. And also, if you'll visit either the Helping Seniors YouTube channel or the Helping Seniors website, you'll see some of the TV programs that we've done together with Dr. Kevin sharing this information. So on that front, always a good idea to get help if you're thinking you're having any issues with depression or addiction. And Dr. Kevin would certainly be one avenue to take advantage of. So one last time, Dr. Kevin, just the phone number.
Yes, 321-549-0711. And like Kerry said, I'll be starting up a telehealth type of consulting soon, within the next 2 weeks. But otherwise, I still see clients on a one-to-one basis, in Melbourne or Vieira or Merritt Island, or even in Palm Bay here also.
So that's good. All right. And so, viewer, on this Friday, we want to remind you that the Helping Seniors car raffle is still moving forward. We're looking forward to our new grand drawing day, but you can still get tickets, 1 ticket for $25 or 5 for a $100 donation. Get that information at helpingseniors.carraffle.com, helpingseniors.carraffle.com. And on behalf of Joe Steckler, Kim Bernard, and the entire Helping Seniors of Brevard team, we hope you have a wonderful, happy, safe weekend, and look forward to joining you again on Monday for Helping Seniors updates. Thanks again, Dr. Kevin. Hope you have a good weekend too.